you're watching this, you're probably sitting in a dentist's office right now and you just learned that you have a little cavity on one of your back teeth. So your dentist wants me to tell you about a new way to fill that cavity, a better way for a lot of reasons. And it's called PRR, or Preventive Resin Restoration. Now with PRR, your dentist fills the cavity and then seals the tooth to prevent new decay in just a few minutes. Look how easy it can be. Now imagine this was your tooth. Oh, I know you don't have a tooth this big, but pretend with me anyway. Now this area right here is a cavity. These grooves are perfect spots for new decay to form. Now before now, if you had just this little cavity, your dentist would drill out the decay. But because he was afraid the rest of the tooth might get cavities, he would remove all of this and fill it with what we call amalgam. You call it a silver filling. But now, with this new Preventive Resin Restoration, or PRR, your dentist takes out only the little bit of decay and replaces it with a special filling. It's a kind of a plastic. It goes in soft, and a special light hardens it, makes it really durable. Then, to keep the rest of the tooth safe from decay, your dentist paints the top chewing surface of the tooth with a plastic sealant. That's a lot like fingernail polish or varnish on a fine piece of furniture. It seals all of those grooves and nooks from food and bacteria that cause new cavities. Lights, please. Now, this filling material and sealant are both made from the same tough plastic. Together, they can protect the tooth for a long, long time. And once the job is done, it'll help protect against another cavity. Of course, in order to be sure the sealant is doing its job, your dentist should check it at regular intervals. And since the most popular sealants are white, you can check for any loss or wear. Now, you saw how much less tooth is removed with PRR. That keeps the tooth stronger, far longer, and it looks good too. But the great thing about this PRR is that it seals teeth from new decay, and that can mean far fewer problems. It's really that easy, and it takes just a few minutes.
The Preventive Resin Restoration, a conservative alternative to Class 1 amalgams. Presented by Dr. Richard Simonsen.
In operative dentistry, we are frequently bound by tradition. The development of new techniques is often a painfully slow process. But change must occur in order to take full advantage of the potential of newly developed materials. I'd like to discuss a technique that I feel will establish a new tradition in restorative dentistry. It's called the Preventive Resin Restoration. The Preventive Resin Restoration developed as an extension of pit and fissure sealant therapy. The technique is essentially used for restoring small carious lesions in pit and fissure surfaces. In addition to restoring the tooth, it uses conventional sealant for caries prevention. The preventive resin restoration provides 3 patient benefits. First, It preserves healthy tooth structure by utilizing an ultra-conservative preparation. Second, because it's a bonded restoration combined with minimal tooth structure removal, it leaves a much stronger tooth. And third, it adds prevention to the restorative procedure. By applying sealant to the adjacent pits and fissures, we offer the patient a benefit that conventional amalgams could never provide. Let's compare this new technology to the conventional Class 1 amalgam. Traditionally, in cases of small or incipient lesions, the majority of tooth structure removed in order to restore the tooth is healthy, non-carious tissue. The Class 1 amalgam involves caries removal and extension for prevention, that is, removal of adjacent pits and fissures that are highly susceptible to caries. Extension for prevention weakens tooth structure and could predispose to cusp fracture in the future. The conventional Class 1 cavity preparation was designed to compensate for some of the deficiencies of silver amalgam. Amalgam is not caries protective, and it is brittle in a thin layer. To compensate for this, we simply extend the preparation into all pits and fissures on the occlusal surface. However, supplemental grooves not included in the amalgam preparation will remain susceptible to caries. Also, to provide strength for the amalgam, preparations must be carried into dentin, even if the lesion itself does not penetrate that deeply. The preventive resin restoration represents a conservative, viable option to Class 1 amalgams. This technique first appeared in the scientific literature in 1977. Since then, it has demonstrated excellent clinical results. Using the acid etch technique, we eliminate the need for extension for prevention. The preventive resin restoration confines cavity preparation to carious tooth structure only. You can see that our preparation is smaller than that of the traditional Class 1 procedure. In turn, it leaves the patient with a stronger, healthier tooth because all vital parts of the buccal and lingual enamel remain intact. To complete the preventive resin restoration is simple. We place a bonded posterior composite resin into the conservative preparation, followed by a sealant application to protect adjacent pits and fissures from future carious attack. Now, let's take a look at the technique.
This 17-year-old male presented with small carious lesions in the central, distal, and lingual pits of the left maxillary first molar. The tooth, which has never been sealed or restored, presents an ideal situation for the preventive resin restoration technique. After administration of a local anesthetic, isolation is obtained to prevent moisture contamination during critical bonding steps. Rubber dam use is recommended whenever possible. Examination with an explorer and visible staining confirm diagnosis of caries in the central, distal, and lingual pits. The tooth is pumiced with non-oil-based prophy paste. It is then rinsed and dried thoroughly. Next, a conservative preparation is made using a small round burr in the carious areas. Extension for prevention is not necessary. The preparation consists of caries removal only. There is no attempt to extend into the sound tooth structure. After caries excavation, appropriate base protection is needed. At this time, calcium hydroxide is applied to expose dentin. The tooth is etched in a manner identical to the procedure for pit and fissure sealant application. Etching gel is applied to prepared enamel surfaces, plus remaining caries susceptible pits and fissures for a 60-second period. After etching, a 20 to 30 second rinse is followed by 15 seconds of drying with non-contaminated air. Note the typical frosty appearing enamel surface. Next, a thin layer of unfilled bonding agent, such as Heliobond, is applied to the preparations only. In very conservative preparations, it is difficult to apply the bonding agent. A small brush may be used to properly wet the preparation. Polymerize the Heliobond for 20 seconds using a visible light curing source. Protective shields or eyewear is recommended. A highly filled posterior composite resin, heliomolar radiopaque is inserted into the preparation. This material may be injected directly into the preparation or placed indirectly using appropriate instruments. Adapt the composite for uniform internal and marginal adaptation. It is important not to overfill the preparation. Polymerize the composite for 40 seconds for each 2 millimeters thickness of material to complete the restoration of the prepared areas. To complete the preventive resin restoration, HelioSeal pit and fissure sealant is placed on the remaining etched fissures and over the heliomolar restoration. HelioSeal may be applied directly from the bottle using the plastic cannula tips. The sealant may be manipulated carefully with the cannula tip or by using a brush or explorer to extend and cover all exposed fissures. Any bubbles should be removed before polymerization. Light cure all sealed surfaces for 30 to 40 seconds. If desired, polymerization can be confirmed with careful use of an explorer. Note the polymerized restoration. After removing the rubber dam, check the occlusion with articulating paper. As a final step, high spots should be adjusted with appropriate composite finishing burrs. The tooth is now completely restored.
We've just completed a preventive resin restoration.